Welcome to another edition of Reaching Out. I'm Gregory Floyd, President Local 237 Teamsters. I have a very special panel for today, and let me introduce the panel first. Today is a very important format. We're going to talk about the Health Care Act, known as HCRA, pronounced HCRA. HCRA has been a law that has been established since 1997. It allowed Governor Pataki to delegate hospital prices, but there's little known part of the law that allows the state to charge extra fees on health care benefits premiums in order to pay for some of the services no longer provided or intended. HCRA has quietly ballooned since it was enacted over a quarter of a century ago. HCRA has raised taxes without public notice or debate 14 times. It is now the fourth largest source of state revenue, totaling $6.5 billion annually. It is subsidized by the state's Medicaid payments. The payment comes out of your pocket without you even knowing it. This has been Albany's biggest secret. On today's show, we're going to let the secret out. We'll discuss as a plan to end freeloaders from getting a free ride. Companies like Uber, Walmart, Lyft, they pay nothing. They don't provide employee health care, and it's the law. And this law punishes unions and some non-union employees too. The injustices have to end. Today we have three individuals who know a lot about HCRA. They are part of a coalition which my own Teamster Union has joined to create a plan of action. The HCRA law, which is up for renewal, must be amended. And the vital healthcare safety net for New Yorkers is in need, must be kept. Let us start with John O'Malley, who is the legislative coordinator for the Communications Workers 1180 since 2016. Also, we have Bill Nagel. He is the attorney, political director for the Bricklayers and Allied Workers, local number 1 and local number 7. And we also have Richard Winsten, who is an attorney and lobbyist with the firm State and Broadway. He has lobbied Albany on a wide range of issues. First up, we have John O'Malley. John?
Thank you, Greg, and thanks for having us on this program. I want to present this idea to folks in as plain a language as I can possibly do so that people really get the idea, because nobody really knows about the HCRA taxes. Nobody really understands what they are or how they work and why they're so unfair. So imagine for a moment with me that you're commuting to work for 25 years and you're riding the bus to work. And as you're riding the bus to work, you're one of the 52% of people that are paying the fare, but there's 48% of the people on that bus who are not paying the fare at all. Now, obviously, that would be unfair. Obviously, we would all be outraged at that, the fact that these freeloaders were on the bus. But let's take another step. Imagine that in order to get on the bus, you had to come in through the depot and go through a turnstile, and you had to pay an extra fee at the turnstile. And your fee at the turnstile was going to pay for those 48% of the people to ride the bus for free. So not only are you paying for your own bus fare, but you're also paying a fee for those other people to ride the bus. This is the situation with HCRA. Those of us who are fortunate enough to have medical benefits and have the premiums paid for by our employer or our welfare fund or by the municipality, we also have to pay this extra fee for those other companies who get to have those benefits for nothing. So I really want to just leave you with that and allow the other brothers to put forth some of the details and examples that are going forward. And I'm happy to answer any questions about that.
Thank you. Next up is Bill Nagel.
Hi, Greg. Thanks for having us today.
Greg.
I guess I work with construction unions, specifically bricklayers, and the key issue for us is that obviously, we believe first and foremost in providing health insurance for our members. Many of our competitors in the industry do not do that, the non-union contractors. So there's probably a cost of almost 20% of our labor cost that's just to cover health insurance. And that includes this additional HICRA charge that we all have to pay. So when the non-union contractors bid jobs, and this is very competitive, obviously there's labor, there's materials, there's a profit margin usually in these jobs. But if our labor cost is already 20% higher, then we're not going to win the job. It's going to be too expensive. We're going to be too expensive for the project. So one of the big issues for us is that the HICRA tax punishes our good employers who go out of their way to provide this health insurance benefit for their members, and narrows the size of the market that they can successfully bid in. So we're interested in trying to get a more broad-based tax to replace the benefit that's there, so that we don't take anything away from the benefit side, but that all the employers are all paying something to fund these benefits.
And next up, we have Richard Winsten. Richard?
Well, thank you, Greg. Once again, to repeat what you said, these stealth care taxes that nobody knows about are now raised the fourth largest source of state revenue, budgeted at $6.5 billion. And I should say in last year's budget, they actually raised $7.4 billion, leaving $900 billion excess that was used to balance the state's budget. So we're all in favor of balancing the state's budget, but it shouldn't be solely on the backs of those who are paying these taxes because they do the right thing by providing health benefits. That's completely wrong, absolutely wrong. So we need to change this. And we actually have a bill, a proposal that would do that. And I think we're the first ones in 28 years that have actually come forward with a solution to this problem. There's been some complaining from various groups about it over this time, but we're the first ones to come forward with a proposed solution. So let me talk about that just a little bit. A bill has been introduced in the State Assembly and the State Senate. The Senate number is Senate 8157. I'll repeat that again, Senate 8157, introduced by Senator Jessica Ramos of Queens, represents Jackson Heights among other communities, and is the chair of the Senate Labor Committee. And the companion bill is introduced in the Assembly. It's Assembly 8642. I'll say it again, Assembly 8642, by Assembly Member Andrew Hevesy, who I've had the pleasure of working with now for many, many years. He is a very bright, aggressive legislator. He's done wonderful things as the chair of the Children and Families Committee in the Assembly, and has done a lot to make childcare more affordable in the state. And now he came forward and said, I want to join you in attacking this HICRA tax problem. And we're thrilled about that as well. So just a couple of things to go over, facts about this. These HICRA taxes, the hospital surcharge and the covered lives assessment, which together raise about $6 billion, and again are the fourth largest source of state revenue. These taxes raise the cost of health insurance on the average by $250 a year for an individual and $1,000 a year for a family. When unions sit down to collectively bargain health benefits, these taxes put them 4% behind before they even start to bargain, before they even talk about medical inflation or improving benefits. They are on the average 4% behind. And that's untenable. And it's unfair given the fact that so many employers are paying nothing. And the employers who are doing the right thing by trying to provide health benefits are on the hook for this additional 4%. So what our bill would do, it's pretty straightforward. We eliminate the HICRA taxes on all public employers. And I think Greg or somebody mentioned that the city of New York, this blew my mind, pays about $300 to $400 million a year annually to the state in HICWA taxes. We eliminate that completely for public employers, and we're going to drastically reduce the HICWA taxes on those that are paying them now. And we're going to spread the burden over all the employers in New York State. And we do this through a system of surcharges on three state taxes that exist right now: the corporate franchise tax, the insurance tax, and what's called the pass-through tax, and by an increase in fees on LLC corporations. And that way we preserve all of what are called the public goods in the current HICWA system. And these include some very, very good things like reimbursing hospitals for indigent care and subsidizing the state's malpractice insurance, which we desperately need. And we want to preserve all those public goods. And by raising the surcharges and the LLC fees, we protect all of that. Now, then there is $5 billion of HICWA money that goes to subsidize state payments from Medicaid. State payments from Medicaid are now over $40 billion a year. HICWA contributes 5 of the 40, so that's about 15% of the total cost. That 15% is on the backs exclusively, again, of the employers and their unions who are doing the right thing by providing health benefits. And that is completely unfair and needs to change. And our bill will change that and get rid of that unfairness. So we've done a lot of work here. We don't want to see any healthcare cuts, no cuts in the HICWA public goods. We don't want to see any Medicaid cuts, and our proposals don't provide any Medicaid cuts. We just think that Medicaid should be paid for as it always has been. The $35 billion that is paid for now out of the general fund of the state ought to continue, and that $5 billion that HICWA is paying for ought to be picked up also by the general fund. So anyone who's saying that our proposal will worsen federal Medicaid cuts is being deceptive, because that's not what this bill does at all. So thanks for giving me the chance to explain, and look forward to talking further.
You're listening to Reaching Out. I'm Gregory Floyd, President Local 237 Teamsters. With me, very special panel, John O'Malley, William Nagel, and Richard Winsten. And we're talking about the HICWA taxes. Gentlemen, and we could just have a discussion for the rest of the program. How did we allow this to happen for so many years, almost 3 decades, unnoticed, and people getting away with not paying their fair share of taxes, these companies, and then turn around not giving health coverage, as it was?
Yeah, it's a great question. I don't have the definite answer to it, but I can say this. Like, this system has been renewed in Albany every 3 years, but it's been renewed with no discussion at all. And as we said, these taxes have been raised 14 times during that time period. You know, in my community, if there's a proposal to raise the property tax, everybody's up in arms, everybody's talking about it, it's debated, everybody knows about it. Here, this thing has grown to $6.5 billion, the 4th largest source of state revenue, and no one knows about it. And some of the legislators and people in government who first started this years ago and sort of know about it, they've now retired. They're not on the scenes anymore. And there are very few, if any, people in Albany left who really understand this. And our whole desire here is to shine a light on it, make sure everybody knows what's going on. And we don't feel that it can stand the light of day, the unfairness of it, if the light is shined on it. That's number one. Number two, in Albany, there is a table where these things are discussed, the so-called health table, and it includes health insurers, as it should. It includes hospitals, as it should. It includes the healthcare unions, as it should. But check this. The unions in the state bargain hundreds of millions of dollars of healthcare benefits in their contracts, hundreds of millions of dollars. And they've had no voice at all in these discussions. And our effort is to end that, give them a voice, And our focus first are the horribly unfair HICWA taxes.
Bill?
Yes, I mean, the impact in construction is really something that has a huge makes a huge difference in terms of our ability to win work. And I think the best, our recent example of it I can give you is, for example, the NYU Langone campus that's being built in Brooklyn, brand new hospital facility being performed. The masonry work on the complex is being performed by a non-union contractor that pays no health insurance for its workers. Now, one would think, a hospital that in fact directly benefits from the HICWA taxes that are being collected from all of the union plans, all of the health plans in New York to pay for medical education for graduate students, to pay for indigent care, that they would be sensitive to the fact that they're building their new campus with a non-union contractor that provides no health insurance. Yet, no, because basically it's a win-win for them. They get paying less on the construction side, and they get the benefit that everybody else is paying into the industry. And unfortunately, there's just a lot of businesses, I think, that they're looking at the bottom line, and workers are not put first and foremost in how they think about pricing the construction work that they're doing. The picture behind me is from several years ago, but this is the Plaza Hotel. This was a restoration project on the Plaza Hotel. And if you can tell, this was a non-union project that none of the local one contractors were able to get on. But if you look at the hotel, it's wrapped in a very the scaffolding is wrapped in this it turns out to be very expensive coating that basically makes it look like the exact. It's a picture of the hotel itself. Now, the workers on the job, they're making peanuts, but the hotel goes and spends several $1 million on a wrap. They have no health insurance. They have no, they don't have any benefits at all yet. And they're working probably at minimum wage plus a little extra. But yet the hotel saw fit to spend all this money on the building, on the look of the building. Again, and eventually, we worked out something with the plaza, and we were able to turn this job. But again, it's just sort of this happens all the time in the industry. Property owners, look at an opportunity, they want the lowest price. And unfortunately, the way HICWA works is, it actually disfavors the good employers that are doing the right thing and buying health insurance for their workers, because they're now paying this tax on top of everything else. So, and I should also add that most of the time in the construction industry, those people working for the non-union company, those workers, they're not classified even as employees. So under some of the federal law, they should be paying a penalty for all of those workers that are the uninsured, that they're refusing to pay insurance for. But they're classifying them as independent contractors under state law, and they're not paying any penalty under the federal ACA either. So, and that's a big problem, not just in the construction industry, but we can talk about transportation as well. But again, it's what we're seeking to do is trying to capture all of those different employers in one way or another to get them under the tax umbrella so that everybody's burden is a little less. So,
seem to have lost John.
I think John may have frozen there.
Richard,
if I can jump in, Greg.
Can you tell us what you think this bill, if enacted, will accomplish?
Oh, well, it will accomplish making this system of paying for healthcare fair for the first time, and not just a burden that's loaded onto the backs of the employers and their unions who have been doing the right thing by providing health benefits. So first of all, fairness. Second of all, what we're going to accomplish, as I said, is transparency. Everyone will understand what the system is for the first time. It won't be a secret. It won't be stealth care. And it will be better for that reason. At a very practical level, as I said, our proposal would eliminate $300 million plus burden on the city of New York. And, I know that Greg, that you and Gloria Middleton, who have been very active on this issue, you can use that money to bargain better health care benefits for sure.
Yeah.
And that would be a terrific thing. And the same thing applies across the board. So all the situations we're going to eliminate or drastically reduce spending by spreading it out and make it fairer. So that's exactly what we're doing. And we are building and have put together a coalition to support our proposal, our bill. Greg Floyd was a founding member of that coalition, and Gloria Middleton of Local 1180 CWA. And we're hoping that other public employee unions, particularly city unions, will join us. We've reached out to them and have talked to them, and eventually I think they'll see the wisdom of it. Almost all of the unions in the entertainment industry have joined the coalition. A growing number of building trades, Bill Nagel's Bricklayers, pipe fitters and steam fitters have come in, and we think many more will as we move forward. And we even have two very large employer groups. These are construction subcontractors generally, which includes things like sheet metal and electrical, et cetera. And there's even a group exclusively of electrical contractors that has seen the wisdom of this and has come in. And we think many more union employers and employer groups will join and make this a labor management issue, not just a labor issue. So we're very excited about this, and we're seeing it grow every day. We have a website set up. If anybody who's listening to this would like more information about coalition or our bill, the name of the website is reformhicra.org. That's reform, REFORM, HICRA, HCRA.org, reformhicra.org. Come to the site, check it out. We're going to put plenty of material on there, and you'll learn a lot. And again, we're going to shed light on this subject.
Okay. I see John is back. John, we got 30 seconds before we end the show. I'm sorry you missed.
That's okay. Sorry about my technical difficulty.
Okay.
I just wanted to add one thing that I think is really important. As you know, we've been struggling. We've been working with the city, negotiating for over a decade to try to deal with these out of control healthcare costs. And this is definitely a way, where we could save the city up to $400 million. I don't know why we're paying $400 million so that Walmart's employees can have benefits instead of that.
Which they don't get.
Which they don't get, right?
Yeah.
Or if they get them from the taxpayers, right?
Yeah.
So we need to just make it fair. We need to control our own costs with our own destiny and our own bargaining, and be able to pass this legislation so that everybody pays their fair share.
Okay. Thank you, gentlemen. Thank you to Richard Winsten, John O'Malley, and William Nagel for coming on the show and talking about the HICRA hidden tax. This has been a very thoughtful and fruitful instruction. So, gentlemen, I just want to say I appreciate you all coming on, and thank you for coming on.
Thank you very much, Greg.
Thank you, Greg.
Thank you. Okay. I'm Gregory Floyd, President, Local 237 Teamsters. That's all the time we have for this edition of Reaching Out. My very special guests, William Nagel, John O'Malley, and Richard Winsten were very, very thoughtful, and they the information was flowing. And once again, Richard, if you could give that website for our members, listeners.
Yes, the website is reformhicra.org. That's reformhcra.org.
Thank you. That's all the time we have for this edition of Reaching Out.